to personally thank you very much and the Fair Care Alliance. This is a public advocacy group, and as on behalf of the physicians that work in the trenches, I think it's really important that you've taken this step, so thank you. I'm going to talk to you today about why we need a new tower in Nanaimo, a new hospital tower. NRGH was originally built in 1963 with a capacity of 200 beds. It's now expanded to 345 acute care beds, and it's the 7th busiest hospital in BC. Nanaimo is the 2nd fastest growing city in British Columbia and the 5th fastest growing city in Canada. NRGH serves a local population in the regional district of more than 285,000. But remember, NRGH provides some tertiary services such as ICU and kidney care for a population in the central North Island of about 460,000. It's the busiest emergency department on Vancouver Island and one of the busiest in BC. It's no surprise then that NRGH regularly runs at or more than 120% capacity with 420 inpatients or more. This means not only is the ED overrun with emergency and inpatients in hallways, but on wards as well, where closets and storage areas are used for patient care, where patients are crowded in spaces converted as Nightingale wards. Those are open rooms reminiscent of wards from the early 20th century. These care spaces have no privacy and thus no dignity for patients, our sickest patients in the community. There are no barriers to prevent the spread of disease or even washrooms or windows, and there is no access to basic life-saving equipment such as oxygen or suction. In addition to overcrowding, the hospital structure is inadequate to meet even current needs. Aside from patients, hallways are crowded with the equipment from computers and monitors to infection control carts required for patient care, frequently in breach of fire and occupational health codes. The current tower is inadequate even to renovate to create more patient care areas. The infrastructure, plumbing, electricity, and so on is antiquated and barely able to meet current needs without ability to upgrade it. The walls are filled with asbestos, making even simple alterations expensive, inefficient, and extremely difficult. There is a 1 in 3 chance of a major earthquake in Nanaimo in the next 50 years, but the current hospital structure is a death trap, falling far below any standard of seismic stability. There is an urgent need, as you'll hear today, to expand tertiary services at NRGH so that our community has the same access to life-saving care as residents of South Vancouver Island, and indeed of much of the rest of the first and even the third world. This is a benefit not just to the communities of the regional district of Nanaimo, but to improve access to care for residents throughout Central and North Vancouver Island. Rationing of regional island-wide services should not be done solely on the backs of residents of the north of the Malahat. We desperately need an expansion of tertiary services, such as cardiology, vascular surgery, neurology, and interventional radiology, so that residents of Central North Island have timely access to life and limb-saving treatment. It's great to have a new cancer center, but how will we meet the inpatient care needs of cancer patients when they require them, without a larger hospital with more specialized services? NRGH is an overcrowded, crumbling, and inadequate facility that cannot meet the future needs of our communities. Based on the services we provide now, we need a new inpatient tower with more beds just to meet current and future needs. But Nanaimo needs a much bigger hospital, more than 600 beds, with the space and infrastructure to provide new services to ensure citizens throughout Central and North Vancouver Island have the same access to life-saving care as those in Victoria and others in most of British Columbia. Thank you.